thought this topic up some time ago, certainly before the tragic things that are happening in Israel at the moment. So I think it's a very sad time. But I'll explain how I came up with this topic. And it really goes back to when Pam and I went to a pacemaker conference in Jerusalem in 1987. And it was a great experience to go to Jerusalem, of course. And the thing was, when we were there, I managed to purchase some documents, manuscripts. And I didn't know whose they were, but they were put in, and I put them in my suitcase, and they stayed there, and I brought them back to New Zealand. It transpired that they were by William Bowman. Now, as you mentioned, William Bowman, we know for his kidney work. Well, there's Jerusalem, of course, with the Dome on the Mount and the Wall of Solomon's Temple, which is very precious and specifically to the Jewish people as the prayer wall. And that's William Bowman, born in 1816, not very long after the Battle of Waterloo, a few months after the Battle of Waterloo. So that puts him into perspective. So yes, you're quite right. So William Bowman was really known to us all because of his work with looking at the renal capsule, again, and the capsule called Bowman's capsule, which we learned. In fact, these diagrams are from my old hand histology, which we had back in the early 60s, which demonstrate how that came about. And this is what Bowman sorted out, that the arterial cluster were vaginated into the blind end of the nephron in this way, giving rise to the anatomy of the Malpighian or renal capsule. And that's what he sorted out actually in 1842. And it was very interesting because at that time he had a very rudimentary microscope to use. He had no stains, no way of preserving the tissue. He had no microtomes to actually cut it, to look at it. So the tissue was actually teased out and looked at with this early microscope. And then he actually, that's the other picture from Ham, which shows the final capsule. And that is the Bowman's capsule, comes right around and around all the capillaries and so on. And the structure of that, of course, has been elaborated more with the use of the electron microscope. And this is the diagram that Bowman used when he actually presented this study at the Royal Society in 1842. And these are all, remember, he's just teased the tissue out, he's looked at it under a very simple microscope, and he came up with pretty accurate structure, which we still use today, we still call Bowman's capsule. Associated with this, he tried to work out how it functions. And there was some concern about whether the urine is actually formed by secretion or by filtration. He thought that it was a secretory action. But a few years later, a German showed fairly accurately that it was a filtration. But of course, the Bowman's capsule isn't a simple filtration, mechanical filtration system. It does have a discretionary effect on a number of the substances in the blood to cross that, to go into the tubule. So he was partly right. He wasn't totally wrong. Now, I've mentioned cardiac pacemakers. I'm a surgeon, and nowadays, of course, cardiac pacing is done by our cardiology colleagues. And I've got one here today, David Evan, who's a cardiac physiologist and electrophysiologist, and he will put in the pacemakers, he'll do all the pacemakers, cardiologist for all the pacing. But when it was first introduced, it was basically a surgical procedure. I first came across those surgical procedures when I was a house surgeon working at Green Lane in 1967. And my second year as a house surgeon, I did most of my work at Green Lane, and one of my runs was the cardiothoracic unit. And I worked, of course, with David Cole. And he said to me when I first came onto the run, he said, Ross, if you want to come into the operating theatre, you'd have to do some of your work at night in the ward, which I did. So I was able to go into the operating theatre with him when he put in some of his pacemakers. And in those days, the electrode was epicardial. He made a small thoracotomy, left thoracotomy, opened the pericardium, and stitched the electrode onto the surface of the ventricle. And the wire connecting it to the pacemaker was drawn down through the diaphragm, and the pacemaker was inserted put into the abdominal wall. Now this is a pacemaker somewhat later, but they were pretty chunky things in those days. This heavy thing like this, so this was stuck into the abdominal wall. So you had to get it at the right level so it didn't come where the belt was, or so it would be comfortable. The problem with that sort of pacing, it worked very well, was that the simple wire that was used with the continuous beating and flexing of the wire, it broke. So we had a number of those coming back in, failing to pace because the wire had broken. When I came back to work at Green Lane after I did my fellowship in general surgery, there had been considerable advances, of course, in cardiac pacing by that time. And the solution was that you put the lead through the veins and had the tip of the lead actually in the apex of the right ventricle. So this is the lead you see, and they go over the breakage of the lead by actually coiling it, and it allowed the lead to flex and move, and the wire didn't crystallize and didn't break. So that was the step forward. So by the time I was a senior registrar, I think Alan was back at that time, just arrived back at Green Lane. The pacemakers were put in through, the lead was put in through the vein, usually through the cephalic vein in the pectoral area, and the tip of the electrode was placed in the apex of the right ventricle. If you got lost in the circulation and you wondered which ventricle you were in, you always knew which was the right ventricle because it was heavily trabeculated. And so the tips of the electrode would stick itself into the trabeculations of the ventricle, and it'd be quite fixed. And you can see it's got little tines on it as well to hold it in place. So this is pretty well what the modern pacemaker is like. And David was just telling me that the batteries, the lithium batteries in there last something like 10 years. So they're in pretty well for life. And this cadmium batteries lasted less than a year. So you have to change the pacemaker fairly regularly. So that was cardiac pacing. And when I was appointed to Waikato as a thoracic and vascular surgeon, it was my job to do the cardiac pacing. And I did that for something like 20 years. And it was a very interesting evolution. They became more sophisticated with pacemakers able to judge what their rate should be. They were rate responsive. And then we finally had the physiological pacing by putting an electrode into the atrium, and so that you could pace the atrium and the ventricle together. So here's the atrial lead, and here's the ventricular lead going down into the apex of the right ventricle here. And so that would give you physiological pacing in the proper way with the atrium contracting and the ventricle following on. So it was very interesting. I enjoyed it very much, and went to a number of conferences. We had a very close group in New Zealand of cardiac pacing. I visited the people who first inserted pacemakers and did pacing in Sweden, and so it was very interesting. So it was great when the 8th World Symposium in cardiac pacing and electrophysiology was in Jerusalem in 1987, as you can see, and it was just really wonderful. We had a bit of time to look around Jerusalem and Israel at the same time. But while we were there, in the foyer of the hotel we were staying in, there was a shop which was selling etchings. And when I travelled, I usually tried to pick up an etching of the place, and just as a memento, if you like. And I didn't get anything to do with Israel, but in the shop they had these etchings of Rembrandts. So that's one of them. There were 3 etchings, which I purchased. And you see the date on them, I think it was 1639. These are, I was told, are made from original copper plates, which have been etched by Rembrandt. But they have been obviously printed recently on proper paper. So these are they. But at the end of that negotiation, the gentleman said, well, look, I've got some manuscripts here, medical manuscripts you might be interested in. And he threw them in. And so these are they here. Well, I put them, they went into the suitcase. I didn't have time to really study them at all. I wasn't quite sure. He didn't know where they'd come from, or he didn't tell me. And he didn't know who they were about or who had written them. But they went into my suitcase and they stayed there. Well, after that, Pam, after the conference finished, Pam went back to England, and I stayed on in Israel with a cardiologist that we had met, who was in Haifa, and her husband, who was a magistrate, and I spent a week with him. So with my suitcase, with these things at the bottom of the suitcase, were thrown into the back of his car, and off we went up to Accra, near Accra to Haifa. So we had a swim in the Sea of Galilee, and so forth. This troubled land. It was very interesting. When I got home to New Zealand, I mentioned to Rex White-Sinclair, who was a very keen member of this group, of course. He was a medical historian. And I said, Rex, look, I've got these manuscripts that I've picked up in Israel. I'd like you to have a look at them, just work out what they're about. Well, he picked them up and had a look at them. And we identified them pretty quickly. And that's one of them. And that was a paper on spinal paraplegia read at the Birmingham Medical Students Society in 1835. At that time, Bowman would have been starting his medical career when he was aged about 19. And the other one was on the healing of fractures, pathology of fractures, and that was written about the same time. First paper he repeated that when he moved down to King's College. He gave the paper again. And that's his signature, and that's in that, with that manuscript there. Lovely handwriting. And that's him in 1862, so that's a bit later, but you can see the signature is very similar. And that's one when he was 9 years of age, when he was in Liverpool. He wrote back to his mother. Sorry, it's a bit blurred, but you can see the W and the B's are pretty well the same. And that's the stamp that's on the manuscripts, which shows Tottenham, 1838, and he would have been in King's College by that time. So that worked out what the manuscripts were about, or who had written them. And I knew about Bowman, but I didn't have much time to do a lot of research into it. And so I've been sitting in my study for the last 30 years. And now I'm bringing them out to hear them and try and decide what to do with them. Anyway, just briefly now look quickly at Bowman's biography, basically. He came from quite an intelligent, well-to-do family. His father was a banker, an amateur botanist, and a geologist. He was born in Medicus, which is in Cheshire, which is about halfway between Birmingham and Liverpool. He went to a school in Birmingham, Hazelwood, which was apparently a very different school. Thomas Wright was a highly regarded headmaster. His son became the man who introduced the penny post in England. So he had a very good education. And he started as a medical student in Birmingham, in 1832, so he was only about 16 when he started at medical school. And he worked with Joseph Hodgson. And after working with Joseph Hodgson, and he would have written these scripts when he was in Birmingham, obviously, at that time, 1835. But in 1837, he went to King's College, London, and that was arranged by Joseph Hodgson. And the comment was made that his being a dissenter will create no difficulty when he goes to King's College. King's College was a new university. It was set up in the early part of the 19th century, 1829 or thereabouts, and the medical school, as I'll show you, got underway in the early 30s, and they made it open for everybody. It was set up by the Church of England, but they accepted Jewish people, they accepted Quakers, and I expect that by him being a dissenter, I think he was a Quaker. Certainly Hodgson was a Quaker, as was another member of King's College. So this is Hodgson, who worked in Birmingham. He worked in Birmingham General Hospital. Interestingly, he set up an iron infirmary in 1823, and he was the first president of the Royal College of Surgeons to come from the periphery. So he was obviously a very, he made a name for himself, and he was a Quaker. So he was the one that arranged for Bowman to go to King's College. So this is King's College. It was founded in 1831, the medical department was, and then the hospital in 39. And Bowman was appointed a prosector for Robert Bentley Todd, who was a physiologist. And he made his name, I believe, John, by describing post-epileptic paralysis. Is that right? Todd's paralysis was after an epileptic fit. The patient may well have various forms of paralysis, and that's what Todd made his name. But the thing that Bowman did was he did a lot of work on striated muscle using early microscopes, and was a fellow of the Royal Society in 1841, so he wasn't there very long before he managed to make a name for himself in the Royal Society. And it was in 1842 that the Malpighian bodies, the Bowman's capsule, was presented to the Royal Society, and he got the Royal Society medal for that. And Bowman worked in collaboration with Todd to produce a 5-volume physiology and anatomy book and a encyclopedia of anatomy and physiology. So it was the beginning, I think, at the beginning of the 19th century, of the importance of anatomy and physiology, much as we had when we were at medical school. And it wasn't really until that time that the two areas were merged together to try and understand disease processes and the various diseases that they were dealing with. So these books, incidentally, are available on through Amazon. They have been all republished in Amazon. Anyway, Bowman completed his surgical training. He got his fellowship with the College of Surgeons in 1844, but he then decided that he was going to go into ophthalmology. Now, whether his mentor from Birmingham encouraged that, I don't know. So ophthalmology became his main work after he finished as a surgeon at the King's. Although he came back to King's and still was involved in teaching anatomy and physiology. The great anatomy and physiology department at King's. From 1910, the beginning of the Nobel Prize, that department has won 6 Nobel Prizes in medicine and physiology. Sherrington worked there, Wilkins, the DNA, and Rosalind Franklin, looking at DNA. The last major thing that was worked out there was hepatitis C. Was identified in that same physiology department. So these men were really at the beginning of a great era of physiology and anatomy at King's. So he went on with his ophthalmology. That's Bentley Todd, and he's commemorated in King's. and the campus across the Thames, on the other side of the Thames. It started off on the Strand, and then as it's expanded, it's across the other side of the Thames. So that statue is over on the other side of the Thames, and just go back. That is Joseph Jackson Lister, and this is the man who really invented the really microscopes, and he was a wine merchant, wealthy, did very well. He was a Quaker too, and he discovered or designed the achromatic lenses for compound microscopes. So that was, in fact, Lord Lister's father. And he's a bit younger than Bowman. He followed on after Bowman and did similar work looking at striated muscle. And Bowman was very much a part of his appointment, encouraged his appointment when he was brought back from Edinburgh and from Scotland back to England, back to Kings. So, and he, of course, he was a Quaker as well. So it's a very interesting sort of parallel lives that these two men had. Now, the manuscripts of Sir William Bowman were put together by this man, Sanderson, particularly, and who wrote the obituary for Bowman in Nature. He collected all the papers together, and they were published in 2 volumes, 1892. Now, the manuscripts of Bowman have been reviewed again by this gentleman, Bryn Thomas, in 1965, and he used manuscripts that were basically in the possession of Bowman's great-grandson. And I suspect that most of the manuscripts are still in the family's hands, and they still have letters and so on from Nightingale. Florence Nightingale was very much involved, or rather Bowman was very much involved in supporting Florence Nightingale and in setting up the nursing group. So the manuscripts are still around, and in fact on the internet, I think it was either through Amazon or directly, Lady Bowman, the current Lady Bowman, is giving, if you buy a book of his manuscripts, a summary of his manuscripts, you get a free picture of Bowman. So she's obviously still very much involved with Bowman. Now, I don't want to spend too much time going through the actual manuscripts and the lectures, but I've got photocopies of the manuscripts here. So I've used those, and I can handle those. These are the original manuscripts. They're now not quite 200 years old, but they're there. You can see they're still in good repair. They're still very readable. But I had them copied so that I could read them more closely. A lovely hand he had with his writing. And this is the one on spinal paraplegia. You can see he's actually crossed out the first one, which is a rather gentlemanly introduction, saying, you know, I wondered what I should talk about today, but I thought about it a bit, and maybe I'll talk about this, and I hope I don't offend too many people by my ignorance. So that's the gist of it. But anyway, he's crossed that out, and it was read again when he went down to King's College. This long introduction crossed out. The most important part of it is really in the spinal paraplegia is looking at Bot's disease. And tuberculosis, as you know, at that time of life. Chopin was coughing his way through the salons of Paris, and many people died of various forms of tuberculosis. So he really talks about Pot's disease, and he calls him the illustrious Pot. And they call it Scroff, and of course they didn't know what the organism was at that time. But it's really good. We have references to Brodie and so on. But the interesting thing about it was the wording and his phrasing was really lovely English. I had to look up some of the words in the dictionary there. I didn't quite know what remonissement was. But I looked it up in my Oxford dictionary at home, and it wasn't even there. I looked it up in my Dorland's medical dictionary, and it was there. Remonissement. really means softening, which of course is the sort of appearance that you might get if you came across the tuberculosis in the vertebral body or in the back. He briefly mentions acute myelitis. I'm not quite sure what he means by that. Trauma, cancer, syphilitic, aneurysmal swellings, and hysteria. No mention of things like spina bifida. But this was written when he was 19, so he was quite precocious, really, very quickly. And the other paper was on the pathology of fractures. And he wrote this in 1835, so he did this when he was still a student, if you like, up in Birmingham. And the question was really where callus develops from. Some people said it develops just from the periosteum, and he came up with the conclusion that it developed from other tissues as well, even from the local muscle, or whatever, fascia was handy. But you can see his writing is very clear. I'm not quite sure whether he's written this with a quill pen or whether he's used steel nib pen. Steel nibs were just coming into vogue about this time, so he may have, and I think Birmingham was a place where a lot of the steel nibs were actually, there was a big industry there. But you can see it's actually very clear. That's about the only little splash that I've seen in any of the documents. But it's lovely to read. And he suggested at the end that when the callus was still present, you could still manipulate the bone if it wasn't quite right into proper form. So what's his legacy? Well, I've mentioned the importance of the anatomy and physiology, striated muscle, mucous membrane, the alimentary tract, kidney, Bowman's capsule, of course, Bowman's membrane of the cornea, he described, and Bowman's glands and olfactory mucosa. In ophthalmology, he did very well. He moved across to what became the Ophthalmological Hospital, and he was founder of the Ophthalmological Society in 1880 and the Royal College, and they hold an annual Bowman lecture. So he's obviously held in high regard by ophthalmologists. He promoted the use of the ophthalmoscope. He was made a baronet by Queen Victoria in 1884. He married in 1842 and had 7 children. So really his children have obviously still going strong and still carry because he's a baronet, they carry knighthood. And his Lady Bowman is still obviously doing something with manuscripts. He must have done very well financially because he built this large house out in Dorking, Surrey, which was his home and became a family home until the 1930s when they sold it on and it was demolished. A major input into our surgical training. In the early days, John, surgical training was looked to me to be very haphazard. So by bringing in anatomy and physiology and relating that to the conditions that you're treating, made it just a little bit more scientific and then see what's happening. So King's College, obviously, a great place for physiology. What I'm going to do with these, I'd like to get them back to either King's College or back to Lady Bowman to join the rest of the group. They're very early, so I'm pretty sure they haven't used any of these manuscripts here for any of the publications. Thank you very much.
Well, thank you, Ross. That was a beautifully presented lecture and fascinating story.
It is.
Questions? If you don't mind, some questions. I'd like, have you any idea how they ended up in a shop in a hotel in Jerusalem?
No, absolutely. How did they get to Jerusalem? My guess is that there was somebody who collected these things and moved to Jerusalem, and then they were unloaded, and this was a place, this little shop in the hotel, accepted them, and And I'm not sure that the man who sold them had any idea what their potential worth might be, right? Because I had already worked out the price of those vertebrae. And so he threw those in. So I must have paid a reasonable price, don't you think?
He had no record of the person that how he no.
I never thought to ask him actually, and you know, I was busy at the conference and I went into the suitcase and they stayed there. I didn't look at them until I got home. I got home, fortunately, it was the best.
Result.
Ross, any idea what sort of surgery he would have been doing in the 1850s and 60s as an eye surgeon?
An eye surgery? Yes, I do. Well, to my surprise, he was treating people with glaucoma, and he was getting a little wick of the iris and drawing that out into the conjunctiva where the fluid from inside the eye would drain. He also treated cataracts. And when I was a student working at Waikato, I saw that operation for glaucoma, and for cataracts they would take sort of half the morning to do a cataract. So obviously cataract surgery was very slow. Now I think eye surgeons do 2 or 3 in the morning plus. So they obviously got to fly out and they flies the lens out rather than trying to pull it up. But anyway, the other thing he made a name for was treatment of the tear duct. And he designed probes for that, and I think his probes are still used. Have you got my surgery? No. But I think the probes are still used to treat the probe. How on earth they got on for anaesthesia, I don't know. That must be an important job. For somebody ringing around and their eyes fluttering, how on earth could you do anything? I think it was the very early stages of 1840s, 1850s, the early stages of anaesthesia. Anyone else got any ideas about that? Anaesthetist, what was that again?
The Apollo.
I don't know. The ether was introduced in 1846. Cocaine probably wasn't available till late 1880s.
Cocaine, and Freud didn't find that until the 1880s, did he?
Yeah. So
He was sniffing cocaine himself.
Mason
So his nose went numb.
I don't know what they would have used. Quite amazing.
So in the early days, they wouldn't have had a local anaesthetic in any school.
No. Not
So
really.
really, it's astonishing. And of course, Lister, who followed on after Bowman, made his name because of the infection in fractures or amputations. People who had an amputation, 9 times out of 10 would die from infection. So somebody knows how they got on for anesthesia at that early stage. Chloroform and ether, I think, were the ones that were coming in by the mid-80s, 1800s, should I say.
Any other questions? Well, thank you very much, Bob.
Yes,
That's
Oh, yes, Bible means